Hi, I'm Dr. Brisebois. I am the new physician advisor for the Edmonton Zone Medical Staff Association. And it's been a new pilot role that I'm really excited to have stepped into because we're supporting our physicians in our zone and across Alberta to try to help have better workplaces where we can focus on taking care of patients and doing the things that we love. So with me today, I have Dr. Ling Ling, and I'm very happy to have her here. And I just wanted her to be able to tell her story about her experience with the physician advisor. We had talked about this after I had talked to her, and you were willing to talk and actually wanted to share your experiences. Maybe I thought you can just start by introducing yourself and telling me a little bit about, you don't have to give specifics about your situation, but just how it was impacting you.
Yeah, thanks, Mandy. Thanks for having me. I am an internist and allergist. I work at the University of Alberta Hospital, and I came to Mandy because I did have a conflict, an interpersonal conflict at work, and it was really affecting me a lot. And I was definitely taking it home. I was thinking about it all the time, and I was really upset by it, and it really stressed me out a lot. And I'm sure my husband heard about it nonstop. And I really came to Mandy because I wanted to have a way to move for myself, mainly to move forward and to free myself of, this negativity and stress that it had caused me in my life. And so I worked with Mandy. We came up with, it was a three-step, I think three-step module. And it really, and it culminated, the modules culminated in a meeting with this person, and that I felt really well prepared for. And somewhere in that process, I just realized, at the end of it, that I could let it go, and that I had let it go, actually. And I'm not usually the type of person to be able to let things go so easily. But I realized at the end that, what, I don't need an apology, and I don't need, any kind of restitution or punitive measures for this person for me to move forward. And that was very freeing, actually, for me. And I'm really glad I went through it, because when I came out the other side, I literally don't think about it anymore. At the end of that meeting, I didn't think about it, and I really haven't thought about it since, until now that we're talking about it today. So it was really, yeah, I was really grateful to be able to go through it, to be able to be walked through to be able to walk through an entire strategy. I also did read Critical Conversations, which was a very helpful book as well, to help me kind of understand where I was in my mindset, and where I needed to be.
I really love hearing your perspective, which is one of the reasons why I think we decided to do this. But the book, Crucial Conversations, I think that's one of the things we talked about because you had already delved into it. And it talks about this victim, villain, and helplessness language that we're trying to get away from. And it's so easy to read and it's harder to apply.
Yeah, I once you read it, you kind of recognize, I think, your own thinking patterns, because it's very, very easy. Well, it was easy for me, actually, to kind of fall into this victimhood, that, I felt like I was wronged, and I felt like that person had wronged me. But, once you kind of go through the three modules, it asks you to list the stakeholders. Part of it asks you to list the stakeholders and asks you to think about their perspective. And I found myself a little bit unwittingly, actually, getting, being very sympathetic or empathetic to this other person, which I was a little bit surprised by, because it was not like, had not been what I thought would happen. And so it also helped me move on and be able to, yeah, not be affected by this, which is really, Mandy, as you asked me at our first meeting, what do you want out of this process? And I said, I want to be freed from this stress and this negativity in my life. I'm cooking and I'm thinking about this, and I'm brushing my teeth and I'm thinking about this. And it did allow me to do that. And I'm able to work with this person or in the same environment as this person now. And occasionally I have to talk to this person about clinical care or something that affects both of us, since we are we do work in the same environment. And I don't feel really any negativity at this point. I don't, it's not that I've forgotten what happened. I just don't let it doesn't affect me anymore, and it doesn't affect my interactions with this person moving forward.
I love that story. Tell me, because I know you've told me this before, and you can pass on the question if you don't like it, but what were you expecting when you decided to reach out for some support?
Yeah, I wanted somebody who was an expert, which you are in conflict resolution, or somebody who's gone through, an evidence-based or knows of an evidence-based way or process to resolve interpersonal conflict. And I was hoping to be walked through it, and I was hoping for someone to kind of validate my feelings, but then also kind of guide me through past the feelings phase, past the emotion phase and into moving forward. And I wasn't sure how you were going to do it, to be honest, but it kind of just, yeah, it kind of just happened. I don't think there was any like one moment. It kind of, as you work through the modules, you kind of just, for me anyways, I found by the end of it, at the meeting at the end, with with a medical, like a physician leader, it was really short meeting. I think it was scheduled for an hour and we were done at like half an hour. And I think the physician leader sort of at this meeting to try to resolve this problem was like quite surprised that we were done. And because for me, I had resolved it for myself already. Like I was ready to move on going to this meeting. I feel like if I'd gone into this meeting waiting for resolution or waiting for someone else to tell me how to resolve it, that it would not have been productive, and it would not have, probably lasted much longer, to be honest. So I went into this meeting already been able to move on, being able to move on. So I didn't feel the need to rehash every detail. I didn't feel the need to argue any certain points about what somebody did or didn't do, say, didn't say. I was able to just get above that or rise above that and just say, you know what, I know you say that was not your intention, but that's how I perceived it. So I didn't have to argue with this person, whether somebody did or didn't do anything. And that's, yeah, not productive. So
It's really interesting to hear that. It's been something that I reflected on in my own leadership roles, that I feel that I faltered because I didn't do any pre-planning. And after I went and did training, and you talk about process, I didn't realize there was a process to being able to do. I knew mediation was a process, but I thought that was at the end of the line, like when you were in super big trouble. I didn't realize that you could apply this process early on, and that the whole planning for the meeting was what it was all about. Like I
yeah,
always thought it was
I
in my
was so
mind.
prepared, right? I
Yeah,
felt so prepared. I'd
yeah.
done so much work, and I'd really actually most of the work had already been done. Or I would say almost all the work had already been done at the, by the time I went to the meeting. And Mandy, like I feel like, I've reflected back on this, and I say, as I say to people, workplace conflict or disagreement, occurs whether you work at a car dealership or Tim Hortons, or you work at, the hospital. So it's pervasive, and it's unavoidable. You will all have it, whether it's a disagreement over the coffee maker or something else. Um, it will happen, and I think you can apply that sort of same three steps to every one of those disagreements, so that you don't let it, build up and become something much bigger or much more toxic, for me at least.
You're absolutely right. Like trying to promote those principles that a mediator would use in the worst situation. And I find myself doing this because I never did it before, but same as you're saying, then when you get in something that seems kind of simple, you start thinking, well, how do I actually figure out what the issue is neutrally? I'm not going to call them names or anything, but what is it about the coffee maker? So what's the actual thing that affects us both? And you start doing it. And I loved when you came into this, because it's a very typical thing for physicians. We want evidence. We want to know that this works. We want to know there's a process, because we're smart. You know, we don't want to just enter something and spend all our time doing something if it's not going to work. So thank you so much. I am very, very happy for having worked with you. I'm excited to see everything that you do in your job and all your leadership roles. And
Thank you, Mandy.
appreciate it. Thanks so much.
Thanks.
Okay.
Bye.